I'm going to be administering a tube feeding today. What I want to do first is verify my medical orders. I want to check the type of the formula and the concentration I'm going to use, the volume, the route, the rate, and the frequency. I will gather all of my equipment and I will check the expiration date on the formula that I'm going to use. I'll perform hand hygiene, identify the patient by 2 identifiers. I will assemble my equipment and the way I'm going to use it, and then I'm going to perform a abdominal assessment of my patient. I will position the bed in an elevated position with at least 30 degrees, and I will put on gloves and verify the tube placement. I can verify the tube placement by position of marking on the tube. I can measure the length of the exposed tube and compare it to whatever I have in the documentation already. And I can check the pH. I can flush with 30 milliliters of air, aspirate a small amount of stomach content and check the pH. I can also visualize the color and the consistency. I can aspirate all gastric content and measure the amount. And I will return it back to the patient's stomach or not, depending on what the faculty policy says. For the 2 types of feeding that we're going to do, for the intermittent feeding, I'm going to check the stomach contents prior to feeding each time. And for continuous feeding, I'm going to do it every 8 hours or depending on the agency protocol. What I want to do is I want to flush the tube with 30 milliliters of sterile water. And in neonate patients, I'll flush with the lowest amount necessary so I can clean the patency of the tube. I will remove my gloves and perform hand hygiene, and I'll put on new gloves. And administer the feedings. For the open feeding system that I'm going to do first, it will be the feeding bag one. I will have labeled the bag and the tubing. I will perform my demographics and also the formula type, the administration method, the time and date prepared, and the time and date that I hung it. What I want to do is put warning labels on the tube itself and on the tube that is coming from my pole, and the tube that is on here, and I'm gonna put a sign that says warning only for enteral feeding, no IVs. I'm gonna hang the bag on my IV pole at least 12 inches above the stomach, and I will clamp the tubing. And also I'm gonna prepare the feeding setup. I'll check the expiration date of the formula again. I will cleanse the top of the feeding container before I open it with an alcohol gauze. I'll pour into the feeding bag, I'll prime the tubing, and I'll clamp the tubing. After this, I will attach the feeding setup to my feeding tube and connect the feeding tube. I'll set the prescribed rate that I'm gonna use for the feeding, and I'll unclamp the tube. I'll flush it with 30 milliliters of sterile water again, and the feeding bag and tubing, or the feeding tube, and I'll also rinse the feeding bag and the tubing. I will clamp my tubing, and I'll disconnect the feeding setup from the feeding tube. What I want to do is maintain the patient in an upright position of at least 30 to 45 degrees for at least 1 hour after the feeding, so they don't aspirate. And for the closed feeding systems, I will pretty much do the same thing, but I'll check the expiration date. I will label the bag and the tubing again. I will spike the container with the compatible tubing, just so I make sure everything's working properly. I'll prime the tubing. I'll connect the tubing to the feeding tube, and I'll connect it through the feeding pump, and I'll set the prescribed rate. And then I will discontinue the feeding setup from the feeding tube, and I will flush the feeding tube with a minimum of 30 milliliters of water. And that will be feeding today.